A single drop of blood. That's where it usually begins. Not pain, not a loose tooth, not an emergency, just one tiny drop of blood in the sink. Most people see it and immediately tell themselves the same thing. I brushed too hard, so they wipe the sink, finish getting ready, and forget it ever happened. The next morning, it's back. Then it disappears for a few days, then it comes back again. It doesn't seem important. Until months later, their dentist says something they never expected. We should have caught this sooner. The difficult part about gum disease isn't that it happens quickly, it's that it happens quietly. And today, I'd like to show you 7 warning signs your gums may already be giving you before they become much harder to ignore. Hello, I'm Dr. Daniel Brooks. For more than 30 years, I've helped people save their teeth. And if there's one thing I've learned, it's this. Your gums almost always give you warning signs. The problem is, most people don't recognize them until much later. Let's change that today. Warning sign 1, bleeding that keeps coming back. Let me ask you something. When was the last time your gums bled? Yesterday, last week, maybe this morning? If your answer is yes, you're not alone. One of the most common things patients tell me is, "Doctor, I thought I was brushing too hard." Sometimes, that's exactly what happened. But when bleeding keeps returning, especially in the same area, your gums may be trying to tell you something. Healthy gums are surprisingly strong. They shouldn't bleed every time you brush or floss. When they do, it's often because bacteria have been sitting along the gum line long enough to irritate the tissue. Think about your skin. If your hands started bleeding every time you washed them, you wouldn't ignore it. Your gums deserve the same attention. Now, here's the mistake I see all the time. People notice blood, and they stop brushing that area. They think they're giving the gums a chance to heal. Unfortunately, plaque keeps building. The bacteria stay, and the inflammation often gets worse. If bleeding continues for more than several days, despite brushing gently and cleaning between your teeth, it's worth making an appointment with your dentist. The earlier inflammation is treated, the easier it usually is to manage. But bleeding isn't always the first thing people notice. Sometimes the first clue is something far more embarrassing. Warning sign 2, bad breath that never really goes away. Imagine this. You're about to meet someone, you chew a mint, maybe even 2. For a few minutes, everything feels fine, then the unpleasant taste comes back. The mint didn't solve anything, it only covered the smell. Persistent bad breath isn't always caused by what you ate. Sometimes it's coming from bacteria hiding beneath the gum line. Those bacteria produce compounds that smell unpleasant. And no mouthwash can permanently fix that if the bacteria remain. I once had a patient who spent nearly a year trying different mouthwashes. Nothing worked. Not because the products were bad, because the real problem wasn't on the surface. It was underneath the gums. After treating the inflammation, his breath improved without changing toothpaste. That's something many people don't expect. Fresh breath doesn't always begin with stronger mouthwash. Sometimes it begins with healthier gums. The next warning sign is so gradual, many people don't notice it until they compare an old photograph with a new one. Warning sign 3, your teeth look longer. Have you ever looked at an old family photo and thought, my smile looked different back then? Maybe your teeth seem longer now. Here's something interesting. Your teeth didn't grow. Your gums slowly moved away. This is called gum recession. It usually happens little by little, month after month, year after year, so slowly that your brain adapts to it. Until one day, you can't unsee it. Receding gums expose the roots of your teeth, and unlike enamel, those roots are much more sensitive. That's why cold water, ice cream, or even cold air may suddenly make your teeth hurt. If you think your teeth are getting longer, don't ignore it. Your gums may be asking for help long before you feel any pain. Now, let's talk about something most people completely overlook: It doesn't happen in the mirror. It doesn't happen while brushing. In fact, many people don't notice it until someone else points it out. Warning sign number 4. Your gums look puffy instead of firm. Have you ever looked closely at your gums? I mean, really looked? Most people look at their teeth. Very few ever look at their gums. Healthy gums are surprisingly boring. They're firm. They fit tightly around your teeth. They don't look shiny. They don't look swollen. They're simply quiet. Inflamed gums are different. Sometimes they're darker. Sometimes they're bright red. Sometimes they look smooth, almost as if they've lost their natural texture. Then comes the swelling. Not enough to scare you, just enough that something feels different. Maybe popcorn gets stuck more often. Maybe floss suddenly feels tighter. Maybe brushing feels uncomfortable. One patient once smiled and said, "Doctor, my gums feel puffy." That was the perfect word, puffy. When bacteria stay around the gum line for too long, your immune system sends extra blood to fight them. That's actually your body trying to protect you. But if the bacteria remain, the inflammation stays too. The gums become swollen, more delicate, more likely to bleed. Here's the good news. At this stage, the damage is often still reversible. Remove the plaque, improve daily cleaning, give the gums time to recover. Many people are surprised by how quickly healthier habits can improve mild inflammation, but only if you catch it early. The next warning sign is one that almost everyone blames on getting older, but that's not always the real reason. Warning sign number 5. Your teeth don't feel as solid as they used to. I'd like you to imagine biting into a crisp apple, something you've done hundreds of times before. But today, one tooth feels different, not painful, not loose enough to move dramatically, just not quite as solid. It's a strange feeling. Most people ignore it. I must be imagining things. But sometimes, you're not. Here's something many people don't know. Your teeth don't simply sit inside bone like nails in wood. They're supported by thousands of tiny fibers. Those fibers act like miniature shock absorbers every time you chew. Healthy gums protect them. Healthy bone supports them. But when gum disease progresses, the infection doesn't stay at the surface. Over time, it may begin affecting the bone that supports your teeth. That doesn't happen overnight. It's incredibly slow, which is exactly why people miss it. First, the gums become inflamed. Then, the support underneath begins changing. Months later, a tooth simply feels different. That's often the moment patients decide to make an appointment. And I'm always glad they do, because the earlier we understand why a tooth feels different, the more options we usually have to protect it. Not every loose-feeling tooth is caused by gum disease. Grinding your teeth, a cracked tooth, or even the way your bite comes together can create similar sensations. That's why one symptom alone never tells the whole story, but it's always worth investigating. Now we're moving into one of the warning signs people almost never connect with their gums, yet I hear patients mention it every single week. Warning sign 6. Your teeth suddenly become sensitive. Picture yourself taking a sip of ice water. Instead of feeling refreshed, you feel a quick, sharp sting. It lasts only a second. Then it's gone. The next day, hot coffee causes the same reaction. A week later, cold air does it too. Most people immediately think, I must have a cavity. Sometimes that's exactly what's happening, but not always. As gums slowly pull away from the teeth, they expose the roots. Unlike the crowns of your teeth, the roots aren't protected by thick enamel. They're much more sensitive. That means temperatures, sweet foods, even a cold breeze can suddenly trigger discomfort. One patient laughed and told me, "Doctor, I thought I was becoming allergic to ice cream." Thankfully, that wasn't the case. His gums had simply receded enough to expose part of the root. after treating the underlying problem and adjusting his daily routine, the sensitivity became much more manageable. Sensitivity doesn't always mean gum disease. It can also be caused by worn enamel, cavities, cracked teeth, or teeth grinding. But when sensitivity appears together with bleeding gums, bad breath, or gum recession, it becomes another important piece of the puzzle. Your mouth rarely gives you just one clue. It usually gives you several. The key is learning how to recognize them before they become bigger problems. We've covered 6 warning signs. There's only one left. Ironically, it's often the sign people notice last. And once you understand it, you'll never look at your smile the same way again. We've talked about bleeding, bad breath, receding gums, swelling, loose teeth, sensitivity. Now, there's one final warning sign. Ironically, it's the one many people notice the latest. Warning sign number 7. Your bite doesn't feel the same anymore. I'd like you to think about the last time you ate something crunchy. Maybe it was toast, an apple, or a handful of nuts. Did your teeth come together exactly the way they always have? Or did something feel slightly off? Not painful, not dramatic, just different. Most people can't explain it. They simply say, something doesn't feel right anymore. That feeling deserves attention. Healthy teeth usually fit together the same way, day after day. When your bite slowly begins changing, it's often because something underneath is changing too. Sometimes it's a cracked tooth. Sometimes it's years of nighttime grinding. But sometimes the bone supporting one or more teeth has begun changing because of advanced gum disease. These changes don't happen overnight. They're incredibly slow, which makes them easy to ignore until one day, your smile simply doesn't feel like your smile anymore. That's why regular dental checkups are so valuable. Dentists often notice tiny changes long before patients ever feel them. Sometimes, we compare today's x-rays with ones taken 2 or 3 years earlier. What looked perfectly normal back then may now tell a completely different story. The important thing to remember is this. If your bite suddenly feels different, don't assume it's just part of getting older. Find out why. So, what should you do if you notice these signs? At this point, you might be wondering, Doctor, what should I actually do? Fortunately, protecting your gums usually starts with very simple habits. Not expensive ones, not complicated ones, just consistent ones. Brush gently. One of the biggest myths I hear is, if I brush harder, my teeth will be cleaner. Actually, the opposite is often true. Healthy brushing isn't about force, it's about technique. A soft toothbrush, small circular movements, and taking your time. That's usually far more effective than scrubbing as hard as possible. Clean between your teeth. Your toothbrush can't reach every surface. That's why floss, interdental brushes, or a water flosser can all play an important role. Plaque loves hiding where toothbrush bristles can't reach. Removing it every day gives your gums the chance to stay healthy. Don't wait for pain. This may be the most important message in today's video. Pain is often a late symptom. Many people with early gum disease feel absolutely nothing. No pain, no swelling they notice, nothing. That's exactly why routine dental examinations matter. They're designed to find problems before they become painful. Take bleeding seriously. A single episode of bleeding after accidentally brushing too aggressively isn't usually a reason to panic. But if bleeding keeps returning week after week, your gums are asking for attention. Listening early is almost always easier than repairing damage later. Before we finish, I'd like to give you one simple habit that takes less than 10 seconds. Tonight, after brushing your teeth, don't look at your teeth first. Look at your gums. Notice their color. Notice whether they look swollen. Notice whether they bleed. Notice whether they're pulling away from your teeth. Those few seconds, repeated every evening, may help you notice a problem months earlier than you otherwise would. Sometimes, The best prevention isn't buying another product. It's paying closer attention. After more than 30 years as a dentist, I've learned something that still amazes me. The people who keep their natural teeth the longest usually aren't the ones with perfect genetics. They aren't the ones spending the most money. They're the ones who notice small changes and take action early. Your gums rarely become seriously diseased overnight. They whisper long before they scream. If today's video helps you recognize those whispers a little sooner, then we've accomplished exactly what I hoped. Thank you for spending these few minutes with me. If you'd like to learn more about protecting your smile and understanding your oral health in simple, practical terms, I'd be honored to have you join me for future conversations by subscribing to the channel. Until next time, I'm Dr. Daniel Brooks. Take care of your smile, because it's one of the few things you'll carry with you every single day. And with the right care,